Nigeria's HIV and AIDS response has come a long way, with the National Agency for the Control of AIDS, NACA, leading the fight, through which significant strides have been made in prevention, treatment, and care. Taking the reins from a legacy of distinguished and visionary leadership, each of whom left indelible marks in ensuring that the national HIV response has approached its last mile, is Dr. Temitope Ilori, a seasoned public health expert and NACA's first female Director General. Dr. Ilori brings unparalleled experience and expertise to Nigeria's HIV and AIDS dynamics, combining extensive educational credentials, including a bachelor's and master's in human nutrition and dietetics, dual bachelor's in medicine and surgery, fellowships from the West Africa College of Physicians, National Postgraduate Medical College of Nigeria, and the University of Witwatersrand, South Africa, among others, with proficiency in high-level policy formulation and strategic development, refined during her tenure as Osun State Commissioner for Health and chairperson of the State Agency for AIDS Control and Technical Working Group on Immunization.
I'm a medical doctor by profession. I'm a consultant family physician. I was working in the Department of Community Medicine in the University College Hospital Ibadan before my nomination. I grew up with a mother that was a nurse, and she was into community nursing, family planning, and all that. So we used to have quite a number of people coming to our homes, seeking health care and all. So even before I gained admission to the university, medicine had always appealed to me. I just felt like helping people, treating ailments, and of course, having served at the sub-national level as a commissioner for health in the Osun State government, it was also quite an informative exercise, for me to learn some of the policy making, of the government. So I think coming here now, all those, are helping in administering NACA.
As Dr. Ilori assumes leadership, her focus shifts to consolidating gains and accelerating progress.
Top of the agenda is strengthening the multi-sectorial role of NACA. The HIV space, there are many partners. So as NACA, we are that government organization that is actually supposed to help to coordinate all these activities at the national level, ensuring that nobody's left behind, ensuring that we are all inclusive. The women are brought to the table, the young people, and young adults are also brought to the table, ensuring that even the key population, are not left behind. And also the issue of sustainability is very high on the agenda. As we speak to you, most of the funding for HIV response is now, by partners, donor agencies, PEPFAR, Global Fund particularly, and so many others. So we want to, work aggressively to ensure that we have sufficient domestic resourcing, for the national response. And aside from that, as part of sustainability is ensuring that we have local production of the HIV commodities, also top priority. And we also want to scale up the coverage of pregnant women in order to ensure that we prevent, mother-to-child transmission of HIV/AIDS, and also scale up, pediatric coverage, to ensure that we reduce the transmission of HIV/AIDS to children and to reduce the number of children born with HIV/AIDS.
Under its new leadership, the agency's strategy focuses on prevention through innovative outreach and addressing the issue of stigma and discrimination.
We have a lot of programs in terms of prevention, because the key thing is prevention is better than cure. So even in the area of HIV/AIDS, we want to ensure that those that are negative, they stay negative. We are going to be doing this not only by the traditional media, by the social media, but we are also doing a lot of things using, artificial intelligence, and using technology to be able to engage particularly our youth and young people. The issue of stigmatization, the issue of discrimination is also top on our agenda, and we are going to do this by lots of communications, a lot of creating awareness, a lot of engagement, both at the national and subnational level, to ensure that we are able to educate our people, inform them appropriately, and get everybody on board. There is indeed a law at the national level. Even at the states, many of the states have domesticated these laws. I think it's the enforcement that is important to ensure that if people violate these laws, and the appropriate penalties can be meted out to such people. Penalties like fines, penalties like jail terms, actually attached to these laws.
The Director General underscores the vital role of individual action in knowing one's HIV status and adhering to treatment if diagnosed positive.
Now, part of the innovation is we have self-test kits. You don't even have to visit a health center. You can always purchase one or procure one and get tested in your homes. And of course, for those that want to be tested in a facility, all facilities, we have test kit free of charge in our primary healthcare centers, secondary healthcare centers, and even the teaching hospitals. So get tested, know your status. If you're HIV positive, go on medications, because we have very potent antiretroviral drugs now that your viral load will be so low that it will be undetected. And then the message is U equals U, undetectable, untransmittable. So once your viral load is low, then you cannot infect anybody, and the whole community is safe. So that is my message, and my legacy is to ensure that no child is born with HIV infection.
As Nigeria inches closer to ending HIV and AIDS as a public health threat by 2030, NACA, led by Dr. Temitope Ilori, is poised to accelerate Nigeria's progress towards a sustainable HIV-free future, ensuring no one is left behind.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.